Okay, so this is a continuation of cupping the head. We're going to be cupping the temple section. So we're putting antiseptic cream around the cup. This goes onto the spot to mark the spot, as we've demonstrated in previous videos. Around the temple area. Now this is a sensitive spot, and it's even more sensitive if you choose to use a needle as opposed to a blade. The reason we're going to be using the needle is because it penetrates the skin far deeper, and also it doesn't leave such a big mark. Whenever you cut the exterior parts of the face, you know, the face itself or around the face, there will always be some slight bruising or some marks which will persist for a few days or even possibly at most a week or two. But if you use a needle, because the needle itself, it can penetrate the skin at a deeper level, you can access blood, you can extract blood that would otherwise be difficult to extricate from that particular part. Now this is a very painful spot to cut with the needle itself, and it's very painful, as we will demonstrate. So I normally try to think of something else or clench my fist or something, and it kind of makes the pain a bit more bearable. The pain itself is just momentary. I mean, as you saw, it was just for about 10 seconds, after which you don't really feel anything. This is a very safe method as well. It doesn't require any antiseptic cream or anything such as that, or any plasters or anything to cover it. It's also very good for diabetic people as well. So people that complain about migraines, this is a very good spot to cut. It looks a lot more painful than it is. I feel fine. There's some slight discomfort from the suction power of the cut, but other than that, it's fine. If you can withstand the initial piercing of the needle, the rest of the process is very easy to endure. I can't see the cut. I've got no idea how much blood is being extracted. In some cases it's better not to know. As a patient, I just sit on the chair and let our resident cupping expert get on with his job. And that makes the whole process a lot easier. So I can feel the sense of relief on one side of the body, on the right, because we haven't cut the left side yet. So I can still feel some pain on the left. Just remember to close your eye when the antiseptic spray is squirted onto the side of the area. So there's no marks at all. Had we used a blade, there would most certainly have been a mark, and also we would have had to have used antiseptic cream and possibly covered it with some plastering as well. So this is very important for women. You know, obviously women are very conscious of the way that they look and their beauty, etc. So for them to, you know, basically have a mark on their face which persists for over a week. You know, this is something quite difficult. So in this scenario, a needle is actually ideal. The other thing is that it's important for the patient to have no one around them while the needling process is being carried out, because the slightest distraction, the slightest movement, and the needle could end up where it isn't meant to go. You know, in particular, you know, if it's around the temple area, the needle could easily accidentally be misdirected, for example, onto the eye or some other sensitive spot. So it's very important for the person being cut to keep a firm position, for no one to be around him to distract him, and for the cupping expert to accurately control the depth at which the needle enters the skin. Also, the patient should feel as comfortable as possible, so the correct amount of light, the atmosphere and ambience in the room temperature, the comfort factor, the seating, etc. You know, all of these factors should, all of these variables play an important role for the patient. So the patient should be made to feel as comfortable as possible. A bit like visiting a doctor's surgery. You know, the doctor attempts to make the patient feel comfortable so that they can discuss his particular problem and symptoms. Cupping is no different. So we're going to do the left side now. To create symmetry, we've done the right side and we'll do the left side. And I can tell you, I can feel the difference because I've already had the right side done. I can feel the imbalance. The right side feels greatly relieved. I don't feel the headache that I initially felt when I came in pre-cupping. The left side feels a lot heavier, denser. So we've marked the spot, and now we're going to needle the head. So some people, some scaremongers like to misinform people by telling them that this is dangerous cupping around the temple area, but I can safely tell you, after having this done for over 2 years now, that there's no danger. As long as it's done by a qualified or experienced expert, there shouldn't be any issues, and as long as you adhere to strict hygiene controls, you should be fine. So I feel fine during this whole process. It looks a lot more painful than it really is. I'm oblivious to the amount of blood coming out. I'm just sitting back and enjoying the ride. Okay, so now we're going to put the antiseptic spray on. So remember to close the eyes. You don't want to get that going into your eyes. And there's no mark, other than the mark of the circle or the actual shape of the cup. There's no mark within the cup itself because we use the needle. The blood has completely stopped. Also, because this is quite a sensitive spot, it's important to note that it's not cut excessively. Unlike other parts of the body, for example, the back, or even as we've demonstrated with the crown point on the scalp, the sensitive spots, like the sides or around the temple, they're not done excessively.